Over the past couple of weeks, we've been hearing news of windows being smashed in at pro-life pregnancy centers and riots in the streets led by abortion activists.
Why are they here? Why do crowds gather day after day holding signs, raising their voices? Two sides, one issue. Both convinced they are fighting for what's right. But what's really driving them? Is it about freedom? The right to choose your own path? Or is it about life? The defense of those who can't speak for themselves? This battle has raged for decades, sparking protests, debates, even violence. But underneath the noise, what's the truth? What's at stake? And why does it matter so much?
107, and they were dying. And then she was there when Rose came into place, and she said the next year the wards were empty.
Abortion. Is it a question of rights? A matter of faith? Or something far more complicated? Okay. Today we will tackle the abortion debate. Not with easy answers, but with a hard look at the realities that fuel this deeply divisive issue. First, the arguments for choice. Access to safe, legal abortion saves lives. It prevents unsafe back alley procedures that leads to infection, injury, and even death. Furthermore, it empowers women to control their reproductive health, aligning decisions with their life goals and circumstances. Restricting access disproportionately impacts women in poverty, limiting their opportunities and perpetuating cycles of inequality.
Abortion is a process of ending a pregnancy before the baby is born. It happens when the fetus or embryo is removed from the womb, resulting in the pregnancy not being continued. Abortion can happen in two ways. It could be spontaneously or induced. When we say spontaneously, it's being done unintentionally, or meaning to say we call it a miscarriage. On induced, we call it intentionally because it's being done on purpose, like through medication or a medical procedure. In this discussion, when we say abortion, we focus on induced abortion being done intentionally through different reasons. It could be for health, financial, or personal reasons.
Hello everyone! Today, I will be explaining the two main types of abortion, medical abortion and surgical abortion. These are safe and legal procedures used to end a pregnancy, and the choice between them depends on factors like how far along the pregnancy is, personal preference, and access to medical care. First, let's talk about medical abortion. A medical abortion uses medication to end a pregnancy. It is usually offered during the early weeks, up to 10 to 12 weeks of pregnancy, depending on the country and medical guidelines. The two common methods involves taking two medications. Mifepristone, this stops the hormone needed to continue the pregnancy, and misoprostol, this causes the uterus to contract and expel the pregnancy, similar to a miscarriage. This process can take a few hours to a couple of days and can be done at home under medical supervision. Common side effects include cramping, bleeding, and nausea. The most common types of surgical abortions are manual or electric vacuum aspiration, a general suction method used in the first trimester, dilation and curettage or dilation and evacuation, used in the second trimester, involving dilation of the cervix and removal of pregnancy tissue. Surgical abortion is quick, usually lasting less than 30 minutes, with a short recovery time. It's very effective with a low risk of complications. In summary, Medical abortion involves pills and can be done early in pregnancy, often at home. Surgical abortion is a short procedure done by a doctor, often used in later stages or based on preference. It's important to consult a healthcare provider to understand which option is safest and most appropriate based on individual circumstances. Abortion is a personal decision, and access to safe and legal care is a vital part of reproductive health.
The pro-choice and pro-life perspectives are two dominant sides on the debate of abortion. These are those who believe in women's right to choose and those who believe in the right to life of the unborn babies. Let's expound on both sides of the debate. For those who are pro-choice, they place emphasis on a woman's autonomy, which is her right to choose or decide on what happens to her body. They consider the personal circumstances that may lead a woman to consider abortion, as well as citing that access to safe and legal abortion is crucial to women's health, as it prevents them from seeking dangerous and illegal alternatives. On the other hand, for those who are pro-life, they consider the sanctity of life, which they believe begins at conception, meaning when the egg cell is fertilized. Supporters usually incline towards this perspective due to religious beliefs, though it may not be applicable to all of them. They believe that every human, regardless of their development stage, has a right to life and urges women to consider alternatives to abortion, such as adoption. Now, how exactly does religion affect this debate? What is its influence? Well, for starters, religion plays a heavy role in building individual values and beliefs in life, which can influence perspectives or sides that a person can choose to take. Whether an individual is a pro-choice or pro-life supporter, their religion is definitely one factor that can affect this decision. To add on to this, let's take the views of major religious groups as an example, starting with the Roman Catholic Church and Christianity, which opposes abortion in all circumstances as they emphasize the sanctity of life at conception. The Mormons, members of the Church of Jesus Christ of Latter-day Saints, also oppose abortion with few or no exceptions. Now, there are also religious groups that support abortion rights, including the two largest American Jewish movements, which is Reform and Conservative Judaism. Then, at the center of both of these views, there are religions that have no public position on abortion, such as Islam. Now, in connection to ethical frameworks, this topic can be viewed through the deontological approach, which includes Kantian ethics, focusing on moral rules and duties. Another theory under this approach is the divine command theory, which can be observed in the previous example of followers of the Roman Catholic Church being opposed to abortion as it violates their belief in the sanctity of life. The debate on abortion, although not applicable to every supporter, is deeply shaped by religious beliefs, whether it be to one individual or to whole groups, with the diverse views of the above religious groups, among much more, reflect our pluralist society and shows different perspectives we can have on complex and sensitive moral issues.
So what are the reasons why people tend to resort to abortion? Abortion is deeply personal decision, and people choose it for many reasons. Some face financial hardship and feel unprepared to raise a child. Others may be dealing with health risks and either to themselves or for the baby. There are cases of unplanned pregnancies due to contraceptive behavior. And sadly, some are involved in cases like abusive partner, trauma, rape incident, or sexual trafficking. Every story is unique. It was shaped by complex emotional, social, and medical factors. What's most important is understanding empathy and access to safe and informed choices. That's the thing.
Unsafe abortion and Philippine law. Unsafe abortion is done without proper medical care and can cause bleeding, infection, infertility, or death. The World Health Organization says 45% of abortion worldwide are unsafe, and 7 million of women are hospitalized yearly. In the Philippines, 610,000 of women had abortion in 2012, even though it is completely illegal. Article 256 punishes anyone who are involved in abortion, even the women. There are no exceptions, not for rape, incest, or danger to life. Helpers like doctors or midwives can be jailed.